The TFCC, Triangular Fibrocartilage Complex, is made up of 8 structures on the ulnar side, the pinky side of the wrist, and is responsible for stability of the ulnar side of the wrist. In this video, we'll be covering injuries to the ECU sub-sheath, which is one of those 8 structures. We'll be going through common complaints, assessments to test if you have it, and treatment on how to solve it yourself. The ECU stands for extensor carpi ulnaris, and it is a tendon. The ECU sub-sheath is a connective tissue that holds the extensor carpi ulnaris tendon in place over the distal ulnar bone in this ridge on the ulnar bone right here. People who have injured the ECU sub-sheath usually complain of pain over the sub-sheath itself. If you injured your wrist badly or you've had it for a long time, there might also be pain in these areas: your dorsal DRUJ, distal radial ulnar joint, deep in here in your palmar DRUJ, and or your ECU tendon itself. It will usually be pain when you ulnar deviate, supinate, and flex. So for climbers, when you're on slopers, this way or this way, downward facing side pulls, or sometimes underclings. For rugby players, sometimes when you grab the ball close to your chest, you're doing ulnar deviation, supination, and flexion, holding the ball to your chest hard. Sometimes the ECU sub-sheath can rupture. Or tennis players with their double backhanded stroke, going from pronation to supination rapidly. Any activity that you can think of in day-to-day life can also produce pain and onset of that injury. For example, pouring water from a jug, washing dishes, etc. Sub-sheath can rupture from too much force on it, but usually it's just partially torn or inflamed from too much stress on it. How do we test to confirm that you have an injury to the ECU sub-sheath? Palpation. Usually pressing over the sub-sheath will produce pain. Resisted flexion in pronation should not be as painful, but once you add supination, it produces pain in the area and feels weak in some cases. Combining ulnar deviation will add even more pain. I'll explain this at the end of the video. Another way to confirm would be an MRI or an ultrasound scan. How do we treat it? Passive treatment. Day 2 to 21, a cross-friction massage. Gentle but firm pressure on the sheath, performed for about 1 minute. This makes it hurt more. Then try rubbing softer. Even just a light skin rub would be okay. This is to increase blood flow and collagen synthesis. Repeat every day. Day 0 to 30, brace to hold the ECU tendon in place and keep the DRUJ stable, especially if you are still continuing sport. Tendon flossing. This will prevent the tendon and sheath from sticking together as the inflammation heals the injured tissue. Gentle radial ulnar deviation and gentle flexion extension. Past 2 to 3 weeks after injury, you can consider shockwave therapy. Avoid forceful supination, flexion, and ulnar deviation. Exercises. Isometric extension and flexion in pronation or neutral wrist from day 5 to day 21. In extension and flexion, hold the weight up for 10 seconds, 6 sets, daily. If initially too painful, reduce weight and sets. Resisted extension and pronation. At day 14 to 28, use a pen or a dumbbell that has slightly more weight on the pinky side so that it forces you into supination and you have to resist into pronation. Again, 10 seconds, 6 sets, daily. Strengthening. At about day 28, once everything is feeling stronger, less painful and inflamed, progress to cable rotation, cable chops, and drills that are specific to your sport as pain allows. Make sure the pain is less than 3 out of 10 during and after every exercise. This part of the video is for the nerds and the desperate. So, the reason why it hurts more when we perform resisted flexion in supination is because in pronation, the ECU tendon exits the sheath straight. In supination and flexion, the ECU exits the sheath at a 30-degree angle. It normally glides across smoothly, but if force is excessive or overly repetitive, injury can occur. The angle increases with ulnar deviation, which makes it worse. The reason for pain in these other areas for more severe and long-term cases is because the ECU tendon is a very strong dynamic stabilizer of the distal radial ulnar joint, DRUJ, meaning This tendon gives this joint stability when we use the wrist dynamically. If the ECU tendon doesn't work properly, to stabilize the joint, the radius and ulna will gap open, shift, and rotate excessively, hence injuring the other structures of the TFCC. The other structures being the dorsal DRUJ ligament, palmar DRUJ ligament, ECU tendon itself from working too hard due to lack of ECU sub-sheath stability, and sometimes the TFC disc, the triangular fibrocartilage disc, which lies between the ulnar bone and the carpal bones. I hope this video was helpful. I'm going to be making other videos for each structure of the TFCC, so don't worry about it.